Hello, and welcome to the Heart of Collaboration. We appreciate you. We thank you for allowing us in your viewing audience, and we think we have something especially important for you in this episode of The Heart. And we have as our guest, we have Dr. Whitney Cassity-Caywood. And she is a licensed clinical social worker, and she's also a member of the faculty at Murray State University. And for anybody who's viewing it doesn't know, that's in Murray, Kentucky. Hi, Dr. Caywood.
Hello.
And thank you so much. I know you're busy. We were talking earlier about how you and I work 7 days, 7 nights a week. We just carve out time for different things. And so I really appreciate you being here today.
Glad to be here.
Well, we have some interesting things to cover. We have people who are impacted and even indirectly impacted by the heart of this topic, and that is counseling the sexually abused adults. Mm-hmm. And so that will be our focus, and because of your expertise and experience, we know we're going to be able to cover the things that fall under that topic, and then maybe a few other things that are related. Okay. So to get us started, then let me ask you this. Before a sexually abused adult gets to the counseling phase, what would have needed to take place?
Well, it would depend on whether the sexual abuse or assault was something that had happened recently or something that happened in childhood. If the person wanted to pursue legal means to address the situation, if a sexual assault or abuse is occurring with a child, there's really no choice about that. We are all in the state of Kentucky mandated reporters. And so if any of us know that a child is being abused, that has to be reported to the cabinet for child protection and to law enforcement. If the situation is an adult who has recently been assaulted or is reporting assault that has happened as a child that has not been addressed, it's really up to that person to decide whether to pursue any sort of legal recourse. If a person decides to seek counseling, then they simply need to make contact with an agency or an individual that provides counseling and set up an appointment and go in and do that. And we do have several resources in our community for that.
Now, are your clients primarily those who are aware of your services or word of mouth, or do you get clients through any other system or any other program or procedure?
In my personal practice, I'm in private practice with my counseling, and it's a small practice. Most of the people that I see, it does come through word of mouth or a doctor referral. I haven't personally gotten referrals from a court system. We have an agency here in town called the Purchase Area Sexual Assault Center, and they provide free counseling for people who've been sexually assaulted or abused, and they probably would receive the bulk of referrals that might come through the court system. But I do see people, a lot of the people that I see have had some sort of sexual violence at some point in their lives.
All right. Do you have intake requirements, and if so, what are they?
The intake requirements would be just to fill out some paperwork that I would have to give a general background information, a kind of checklist of symptoms or concerns that the person has. We would discuss insurance if they are wanting to use insurance to pay for services if they see me or a counselor like me, and those things could usually be completed pretty quickly, but that's pretty much the protocol for that, kind of like a regular doctor's appointment.
Well, that's interesting because that's one of the questions I didn't think of to ask you during this time. So in terms of insurance, talk a little bit about that. I know that most people, I think that in our society today, with the prices and the concerns about insurance coverage and all these things, probably for the most part don't have insurance that would cover that type of counseling.
Well, actually, most people's insurance would cover it under mental health counseling. The unfortunate reality is there's a very high prevalence of mental health concerns like depression, anxiety disorders, post-traumatic stress disorder. Those would be the top three. And a lot of the people who've had some sort of sexual trauma unfortunately do go on and develop those in addition to other health concerns. And so I would say in most cases there is a condition, a diagnosable condition that would be covered under health insurance.
All right, a diagnosable condition. Okay, so a layman would say uh, indirect outcomes or consequences that were rooted in the sexual abuse itself,
Yes.
but then kind of exaggerated, so to speak, into depression and
Yes.
anxiety and all those types of things that will affect
Yes.
mental health. All right, I know that you just made some people feel a whole lot better just
Well,
then.
and if I really could give another piece of information,
yes,
there is
please.
a lot of research being done about what's called the Adverse Childhood Experiences Study, the ACEs study, and I recommend this to a lot of clients. You can go online and take a little quiz. There are books written about it. The best book that I found is called Childhood Disrupted, and it starts out with a list of different adverse childhood experiences, including sexual abuse as a child, but including other problems too that people have as children. But the gist of the study they're finding is that adults who have been through several of these experiences as children, their health outcomes as adults are severely impacted. And it's not just mental health issues, but even physical health conditions. So there's a lot of research in this area, and it's getting more and more attention. And it's really, it can be upsetting to people when they first learn. If they take the quiz and they say, I scored a 7 out of 10, so therefore my life must be a complete mess. And what I say to them is, no, it doesn't mean that at all. It just means that what you've been through has had a definite impact on your life, and we do have things we can do about it. It's good to know what we're dealing with. So
Yes. Well, thank you. Thank you for blessing somebody real good just then. As it relates to client concerns and needs, do you address the most recent crime that was committed in their lives, or the most recent, or do you tie this period of time in together? Do you weave it all together for the sake of your client? How do you handle?
well, as a social worker, one of our guiding principles is to start with where the client is. And so I would really take the client's lead. If I had someone come to me who had recently been assaulted and they wanted to do something about that legally, I would be supportive in helping them figure out what the next steps were. But in general, we would do certainly an overview of everything that they've been through. And unfortunately, what we find is that often when people have been abused as children, they're more likely to experience sexual assault as an adult. So sometimes when you see people who have some bad stuff going on, it takes a while to follow it back to the root of where it started. But for a lot of people, it becomes more of an issue than just that one incident.
Yes.
Not always, but it can for sure.
Yes. If a parent wants to bring a child to you, would you accept the child? Is that something that you know that you would need to do, or how would you handle it if a parent made that request?
I would refer. I don't see children in my practice. I don't see anyone under age 18. So I have friends who are certainly competent therapists, or I would refer them to PASAC, or to Child Watch is another agency we have here in town that provides free counseling to children who've been abused or neglected in some way. So if it was someone under 18, I would refer them to someone else that sees children. If it was an adult child, if a parent called me in about an adult child, the protocol for that would be that I would need at some point to speak directly to the person who was wanting to receive services. But I try to be flexible in working with family members if they need someone to kind of help facilitate getting them started. And that's understandable. If a person's unfamiliar with counseling, that can be really intimidating.
How would you, for the sake of audience members, how would you define adult child?
Just if anyone over 18, if I had a parent who had a 20-year-old child that was having difficulty and needed help, that would be what I would consider an adult child. So that would not be at all unheard of to have a parent in their 40s or 50s calling about a child that was, maybe a little bit younger.
All right.
Or if it was an adult child that had some kind of developmental disability that needed assistance in that way.
All right, good. Well, in terms of techniques, we're going to let you just go ahead and have a football field on that, and then share with us your techniques from the very beginning, even to wherever a client is, and what levels a client may be in, and then what would you do at this phase, and what would you do at that phase, and just go with that, Dr. Caywood.
Okay. The first thing that I would do with any client is just a functional assessment to see how they're functioning in their day-to-day life and any areas that may be impacted. And often what happens with the people that I see that have had a sexual assault history of some sort, it may not be the primary reason they come in. Not that many people will call and say, I need to come in because this has happened to me. It just often comes out in the course of talking that it's part of their history. So I would try to see how that sort of fits with what's going on in their life today, how they're functioning, any help or assistance they've gotten for it. I've had many people over the years tell me that I was the very first person they told about an assault that had occurred to them, often many, many years in the past. And when that's the case, it's very important to monitor how the therapist responds to that, and to be very empathetic, not to overreact, to definitely portray that I'm listening and I believe what you're telling me, to take their lead on anything that they feel like they need. Do they feel like they want to disclose this to other people? Do they feel like they want to seek legal recourse? Try to get an idea of where they are with it and what they want to do. After that, it would also kind of depend on the person and how it is affecting their functioning as far as what techniques we would use in counseling. And there are all different techniques, and there are more and more counseling practices coming out all the time, that a lot of them that I don't have training in, but that I know where to find resources for. One of the techniques that I use a lot is called dialectical behavior therapy, or DBT for short. And it was created to help people who have severe emotional distress and kind of chronic suicidal feelings and thinking, which is somewhat common among people who have been sexually abused. So that is a therapy technique that teaches skills to deal with overwhelming emotions. If a person just feels like they cannot calm down, or they are feeling very impulsive and want to harm themselves, this therapy helps them use some concrete strategies to try to calm down and get refocused. So that's one therapy technique that I would use a lot. I've done timeline work with people where they, and this is not something you would do right out of the gate. It's not something I would do right away, but have people sort of put together a written timeline of what they can remember just about their life in general, and where the sexual abuse or sexual assault may fit into that. And that's a technique that I've learned through trainings, because when people have been through trauma, often their memory is disorganized. They don't think about their life in a linear fashion, and it's sort of like there's a lot of stuff up there floating around, but it's not really organized in a systematic way. So the idea of timeline work is that you help people kind of organize it to sort of see how this all fits together. And that's a pretty cognitive strategy that we would use. There are newer therapies that are coming out that are not so much about thinking and processing your thinking. They use more, I don't know how to better way to put it, but try to accessing your unconscious. That there's EMDR therapy, which I don't provide, but we have some good therapists in town through PASAC. Four Rivers has EMDR therapists, and there are other resources in our general area where you can get that type of therapy.
Now, say again what MDR.
EMDR, and that's one that's used a lot. If a person went to, like, say, a treatment facility, and that is sometimes necessary for people who've been through severe trauma, there are inpatient facilities where people could actually go for treatment, say for 30 days or for 60 days. And there are a lot of really innovative therapies used there, like maybe therapy where you would act out different things, almost using theatrical techniques. There's something called internal family systems therapy, where you sort of identify parts of your personality, and that's a therapy I like a lot. I explain to people, it's not saying that everyone has multiple personalities. Right. It's just saying that we have different facets of our personality. Like right now, I'm using a certain part of my personality when I'm at home talking to my 13-year-old daughter. That's a different part of my personality. Or if I'm watching a movie with friends, it's all different. And so trying to figure out which part of our personality is is sort of front and center at any given time. What often happens when people have been through trauma, including sexual violence, is that parts of the personality that are not as functional may be active more often than not. And so that's something that we try to address. So there are lots of different therapy techniques, some that I can do, some that I can't. But I try to make sure that people find the resources they need, whether it's me doing the work with them or referring them to someone who can.
That's good. I like that whole spirit about making sure that you refer, as opposed to being a little egotistical and trying to handle it all yourself. I have had experience trying to work with psychologists and social workers and what have you, while advocating for some people. And some of the unpleasant experiences have involved someone saying they can counsel or work with someone in certain ways, and then I find out later they weren't qualified to do so and should have referred me to another service or to another individual. And that caused a problem. And it just compacted the problem that was already in existence. And we had extra work to do in order to help that young woman. It was not a good thing.
No, that's not good.
And it took time for me to even convince her. And the mother was convinced. The mother came to me, and so it took some time to convince the young woman, we need to do this because you're valuable, you're worth it, you have the rest of your life to work some things out so you can enjoy being who and what God intended for you to be. And I said, but we're going to have to get some people who are qualified to help you, because there are some things I can do, and then I know my limit. And I tell you, Dr. Caywood, it was something to get her to consent to go to someone else. And thank God, thank God, that the next person we went to was the right one. And she's doing real well today.
Good.
She's not here. It was in another town, some people that I've been knowing for a long time. And so she's in school, in college, and she's going for a career. She's still getting counseling because what she went through didn't happen one night and then fixed overnight. So, but it became a wonderful experience after we got the right person. So I really admire you, and I want to commend you for knowing the value and the importance of referring people when it's not your arena or you've gone as far as you can go. So thank you for that. And in terms of technique, what are some of the techniques that tend to take just a little bit more time to help people?
Well, I think in general, people who've been through a lot of trauma, and I have a few clients like that on my caseload, there's often a disruption in what we would call attachment, meaning they don't really trust people, and they may not really trust themselves. And they may not, as you said, really believe they're worth it or that they have any value. And so in those kinds of situations, it takes some time. I can teach the techniques of this is what you can do to just literally calm your nervous system when you're overwhelmed, or here's someone you can go to and have EMDR therapy to try to help relieve some sort of stuck stress in there. But building a relationship, a trusting relationship, is also a big part of the therapeutic relationship, and sometimes that just takes some time.
Yes.
And so I tell my clients, it will take as long as we need to. If you decide this isn't working anymore or it's not helping anymore, then we will move on, or I can send you to someone else. But don't worry that people often say to me, well, I'm worried I'm wasting your time, or I'm not making enough progress, or I'm not moving fast enough. And I just, that is kind of a foreign concept to me, because I just say, you're not wasting my time. As long as it takes is as long as it takes, and I'm not planning to go anywhere, so we'll do what we need to do.
And isn't that evidence that part of the problem is that the time they needed in their formative years and even into the adult years just wasn't provided?
No.
And they always think they're in imposition.
Right.
Second class,
Well, and I think some of that, the nature of sexual abuse or sexual assault is a person being treated like an object. And when that happens to a child, they really, their sense of themselves as a person with value is very distorted, and they feel like they have no worth or like they are an object. And so restructuring that to help someone really start to see their worth, that's a hard thing for them to do. So I'm honored that I get to help people do that sometimes.
What now? This might sound a little touchy, so we'll be very careful how we tread. But sometimes people will go to their pastor, and the pastors are not qualified to counsel in probably most areas. And what would you say to pastors who feel like they need to be all things to all people? And of course, that is not even possible.
No.
And then what would you say to people who feel like the only person that they ought to go to is the pastor?
Well, I always respect people's faith beliefs, their religious beliefs. I think that relying on their pastor is certainly a good place to start, and sometimes it may be what they need exactly. I think most of the pastors I've come in contact with have enough humility to say, this is really not my area, I need to get some help here. The biggest thing that I see would be if a pastor is communicating to a person that they did something to cause what has happened, or that because it happened within their family, they need to just turn a blind eye to it and move on. I've had, unfortunately, some terrible stories told to me about pastors, not anywhere around here and not anytime recently, but them being perpetrators and preying on people who are vulnerable, and that's really disturbing. I've been fortunate to I have not encountered any pastors that around here myself who have that sort of attitude. And my experience has been most people that I've talked with are open and willing and seeking extra help, and would be happy to know what other resources were.
And then persons who feel like the only person they ought to go to is the pastor. What would you say to them and the people who are viewing, who are listening right now, about being confident and comfortable, about not worrying about hurting anybody's feelings, but being more concerned about getting the help they really need?
Well, I would hope that their pastor would help them to see that if they need more specialized care, I often use the analogy, you can't get a heart attack fixed at the urgent treatment center. You might want to go there, and that might be your preference, but if that is not their expertise and the level of care that they can provide, then you're going to need to go to the hospital. So I think just respecting that people have that feeling and may have an aversion to seeing someone like me and to opening up, and that can be really scary for people. I think just it's my job as a therapist and my colleagues' jobs to be as open as possible, to try to be as welcoming as possible. I talk with I also teach social work, so I talk with my students a lot about our core competency of multicultural competence, that we need to understand that people are different and have different things that they want and need, and they communicate in different ways, and be sensitive to that, and just try to keep an open mind.
It's fearful and tragic when persons who finally get up the nerve to go to someone and then to be talked to as if it's their fault.
Yes.
And I don't want to be too blatant, too colorful, but that's like being sexually abused all over again. It's like being raped all over again. When someone comes to you, do you ever have, or have you ever had instances where that story was shared with you? That the initial response?
Absolutely.
Oh my goodness.
Absolutely. Unfortunately, a very common scenario. Most people who are sexually abused is by someone they know.
Yes.
And unfortunately, this often happens within families. And I've heard the story all too many times that they share with their family, this happened to me. And, nobody wants to believe that's happening in their family or to have to deal with the fallout from it. And that's often the initial reaction is, I don't believe you, or you need to just keep that quiet, or we're going to keep that within the family, or I don't want to hear about it. So that's an unfortunate reality.
Yes, and there you are, another brick wall to have to break down with the other brick walls behind it. some of the warning signs that a child has been abused or that a child has been abused.
Right.
An adult, I'm
Yes,
sorry.
and I can speak to a child too. With adults, I think that it might be a little bit harder to pick up because they've had more time to figure out how to adjust to it. We know that adults who've been abused, like systematically or as children, are more likely to have substance abuse problems. They're more likely to have anxiety and depression. They may definitely be more likely to have post-traumatic stress disorders. I would say relationship problems could be another indicator. Sexual acting out, that is another, or over-sexuality would be another indicator in adults and children. If you have a child who is using very graphic sexual language or is simulating sexual activity that they should not have knowledge of, that is a definite warning sign that they've been exposed to things they should not be, or could, abused in some way.
And for adults, I think we have probably a couple of minutes, but for adults, what would be some of those signs?
I would say just maybe the mood disturbance, often there are intimate partner relationship issues. When people maybe are married or something, they may have difficulty with sexual activity because of some history of something that's happened that they have not resolved, and that can cause problems within a relationship. It really could be anything. Again, with adults, they've often had many years to find adaptive and maladaptive ways to address it, and that's sometimes the ways we find to adapt become problems of their own.
Yes, and that's why it's so important to go to the people who can really help you. And as soon as you sense that that's not the person, it's time to go.
Yes.
Dr. Caywood, you are excellent. And I really appreciate it. I know your students are really being blessed by you there at Murray State University. And thank you so much for being the woman, the Christian, the human being that you are. And I know that you have helped people to get their lives back and to get on a better track because they deserve it.
That is my hope. Thank you.
Would you like to say anything else before we leave?
I don't think so.
Well, I tell you what, she's done a great job, hasn't she? Thank you so much. And thank you. And hope to see you real soon on the Heart of Collaboration.